Hello, I'm Dr. Doug Girod, Chancellor of the University of Kansas, and I'm here with my good friend and colleague Bob Page, President and CEO of the University of Kansas Health System. And we're joined today by a few of our colleagues, and you'll hear from all of them in a few minutes. But Tammy Peterman, President of the Kansas City Division of the Health System, Dr. Steve Stites, Chief Medical Officer for the Health System and Vice Chancellor for Clinical Affairs for the Medical Center, and Dr. Matthias Salate, who has been serving as the Interim Executive Vice Chancellor and Vice Chancellor for Research at the Medical Center and is Chair of the Internal Medicine Department for the KU School of Medicine and the Health System. Today, we want to talk about an important evolution that will allow even greater connectivity and collaboration between the medical center and the health system, while obviously maintaining our separate organizations. This last Tuesday, we had the pleasure of announcing the next step in the One KU initiative, which will bring our 5 KU campuses into stronger alignment to position the university for even greater success. And this closer alignment, plus the restructuring of the roles and responsibilities of our existing leaders at the university, really now enables us to focus on ways to strengthen our alignment with the health system. We want to harness the power of academic medicine in even greater ways. And while our organizations have worked together for many years, we believe even greater alignment will allow us to leverage all our successes towards a common goal, to be national leaders in caring, healing, teaching, and discovering. To support even greater alignment, we believe it's important to have senior leaders with roles across both organizations. And to support this, effective today, I'm pleased to announce Dr. Steve Stites will serve as the Executive Vice Chancellor for KU Medical Center and will continue his roles as Executive Vice President for Clinical Affairs and Chief Medical Officer for the University of Kansas Health System. Steve's experience and years of service to both the medical center and the health system really uniquely position him to foster a closer connection between the research and training work of the medical center and the clinical care it ultimately supports managed by the health system. Steve will report to me in his capacity as Executive Vice Chancellor and to Bob Page and Tammy Peterman as Executive Vice President for Clinical Affairs and Chief Medical Officer for the health system. Dr. Matthias Salate will serve as Chief Research Officer for the entire University in Kansas, including the Medical Center, but he will also serve as the Chief Research Officer for the University of Kansas Health System. Matthias will be responsible for developing a research infrastructure that really spans all our organizations. And our intention is greater coordination of the research infrastructure that will improve collaboration. It'll improve our ability to recruit and retain top researchers, to make us more competitive for research funding, and to increase the clinical trial opportunities for our patients. Matthias will report to me in his role as Chief Research Officer for KU, and to Tammy Peterman and Steve Stites as the Chief Research Officer for the health system. As you may have already heard earlier this week from Executive Dean Akinlulu Ojo, Dr. Twal Khan will serve as Senior Associate Dean for Clinical Affairs for the KU School of Medicine and will continue his role as President of the University of Kansas Physicians, as well as Vice President of Physician Affairs for the health system. Twal will report to Executive Dean Ojo in his capacity as Senior Associate Dean of Clinical Affairs, and to Dr. Stites in his role as Vice President of Physician Affairs for the health system, as well as to the UKP Board in his role as President of UKP. I certainly understand and appreciate that this is a lot of change for all of us, but as we look at the future of medicine and treatments and developing the workforce of tomorrow and in how our academic medical center impacts our region, now is the time to make the necessary structural changes that allow us to meet tomorrow's needs and opportunities. We have an opportunity to harness the power of academic medicine in ways we haven't done before, and now is really the time to make that happen. The University of Kansas and the University of Kansas Health System are tremendous assets to the citizens of our state and of our region, and working more closely together will allow us to be an even greater force for the health and well-being of those we serve. And now I'd like to turn the mic over to my great friend and colleague, Bob Page.
Thanks, Doug. When I think back over the past 25 years of the health system and our evolution from near closure to a leading academic health system, one of the constants is our relationship with the medical center. The incredible growth and success we've seen during this time was not predicted, but through hard work and determination, we've made it happen. And we've done it in spite of our separate structures, which sometimes have created barriers to even greater achievements. What makes academic medical centers different is the intersection of teaching, research, and clinical care. Cancer care is a great example of the power of this collaboration. By working together, we are advancing treatments, trials, and research, which are changing how cancer care is delivered. But we can do more. Our research support has not been consistent and intentional historically across all areas. We are looking forward to working with Dr. Salate to build a world-class clinical research enterprise. When Doug, Tammy, and I discussed greater strategic alignment and Dr. Stites, Dr. Salate, and Dr. Khan having dual roles, we agreed this is about more than specific individuals today. It is about a stated and shared commitment among our organizations, supported through new structures which will foster greater collaboration for years to come. Ultimately, this will allow us to deliver even more on the promise of academic medicine. We believe we can advance treatments like cellular therapies, which right now are being used to treat cancer, but in the future will treat many conditions. We will create new approaches to brain health, allowing patients to be who they are while living with a diagnosis. These are just a few examples. Together, we will accelerate the ability to transform lives and our region. Because at the end of the day, our shared vision is to lead the nation in caring, healing, teaching, and discovering. And we can do this right here in Kansas City as one of the few remaining locally headquartered health systems and the largest academic medical center in the region. I'd now like to turn it over to my friend, Tammy Peterman. Tammy?
Thanks, Bob. I love what both you and Doug have said. Now is the time to double down on our commitment to each other and to this region. We've achieved amazing things over the past 25 years. And as we say often, we are proud but never satisfied. We know we can do more. Dr. Stites, Dr. Salate, and Dr. Khan have contributed so much already to our vision to lead the nation in caring, healing, teaching, and discovering. And I am so grateful they're willing to take on additional roles and responsibilities, allowing us to come even closer to realizing this vision. You may wonder if it's possible for them to fulfill their current roles while assuming new responsibilities. The short answer is no. We recognize things need to evolve to allow them to pursue these new roles. One additional change that will occur right away is Dr. Sean Coomer will serve as Senior Vice President and Chief Medical Officer for the Kansas City Division of the University of Kansas Health System. He will retain his position in perioperative services as well. We will continue to look at other changes to support this new structure. This opportunity is coupled with expectations. It will take all of us to support more collaboration. What we know is when we work together toward a common goal, we do great things. We are already doing this in several areas, including cancer, IT, GME, and through the Chief Research Information Officer role. And the Dean of the School of Nursing and her faculty, and the Chief Nursing Officer and nurse leaders from the health system also are working very collaboratively on several initiatives. This new strategic alignment will create an organized structure and a program to do even more outside the silos we have today. We know this will take time, and trust will need to continue to be built across our organizations. I also know we can achieve even greater things working together even more closely. I've been proud and honored to call Steve a colleague and a friend for many years. I'm excited for what he will do and what he will bring to the medical center role. I'd now like to turn it over to my really good friend, Dr. Steve Stites.
Thank you, Tammy, and thank you, Bob and Doug. As Tammy said, I've worked in this health system for 3 decades, or maybe a little more. I've seen how it's transformed from being the worst in the city to the best in the region for patients and for providers, nurses, and staff. And I've seen the growth in our schools of medicine, nursing, and health professions. I've seen us attract some of the top medical talent in the country and from the world for research, teaching, training, and providing care. The trajectories of both the health system and the medical center have never been more promising. We've seen how when we work together with intent, we are successful. At the same time, we are on the cusp of transformational innovations and treatments driven by groundbreaking research and clinical trials. The pace of change has never been more rapid, nor the opportunity so great to leverage our shared resources and successes for even greater impact. Our shared vision means we are working toward a common goal. How we reach this goal looks different for the medical center than it does for the health system. We will each continue to focus on our core areas, but the alignment of these positions will ensure open lines of communication, more advanced joint planning across our campus, and constructive opportunities for informed discussions, all of which will elevate and accelerate outcomes and cures. Today, we provide world-class care ranked amongst the best in the country, We attract and retain the very best talent across the medical center and the health system, and we have a robust clinical research program. We now have a once-in-a-generation opportunity to be even better. I believe in what Doug said. This will allow us to harness the power of academic medicine better than ever before, and beyond anything being done in this region today. We will become national leaders in caring, healing, teaching, and discovering. We know you may have questions and even some concerns. This announcement is just the first opportunity to learn about this new approach. We will be having town halls at the medical center in the coming days, and we will continue to communicate throughout this process. We will ensure you have multiple ways to learn more and ask questions. I'd now like to turn it over to my very good friend and colleague, Dr. Matthias Salate.
Well, thank you, Steve, and thank you all for listening today, and especially for having an open mind moving forward. Research and scientific exploration fundamentally are about having an open mind. It is the opportunity to explore what isn't done today and consider what could be. We believe this closer alignment between the medical center and the health system will allow us to do just that. Explore what can be done even better by being more closely aligned while remaining separate organizations. We have a research enterprise that has grown remarkably with a goal of being a prominent national leader. You know, federal research expenditures have basically doubled in the last 5 to 6 years. This alignment and commitment to organized and coordinated research across the university, medical center, and health system will help leverage resources across our organizations. We will work to remove barriers and foster opportunities across a broad array of research. This will allow us to stay at the forefront of unprecedented innovation happening right now, as Steve mentioned. The future of research and how it will support changing life is bright. And now I will turn it back to my good friends Doug and Bob.
Thank you, Dr. Salate. I hope all of you can feel the excitement this group shares for the opportunities that lie ahead. We are excited to begin planning sessions together in the coming days, looking at what the next 25 years on this campus could look like. We're excited to work together and with you to plan in bold ways and together to make it a reality. Right, Bob?
Absolutely, Doug. I've been part of the health system for a long time, and I have to tell you, I've never been more excited about the future than I am today. Healthcare and medicine are facing challenges, no question. But with aligned senior leadership at the health system, the medical center, and the university, we have the opportunity to do things in new and different ways, which ultimately make us all stronger. This commitment to alignment and new structures will have impacts in the near term, but also for all of you who will continue to support and lead our organizations for years to come. We may be employed by different organizations, but we share a very basic common goal. We want to be national leaders in caring, healing, teaching, and discovering. Through this closer alignment and working together, we can make an even bigger difference. Thank you for what you do every day.